Hey guys, my name is Mindy Pettis and I'm a student physical therapist assistant at Jefferson State Community College. Today I'm going to be talking about interventions for bariatric patients. So just some general information about bariatrics. It is the study of medicine that deals with causes, preventions, and treatment of obesity. The field of bariatrics deals with diet, exercise, therapy, medications, and surgery that are all aimed at achieving and sustaining weight loss. Bariatric patients face a lot of health issues. They're at risk for heart disease, stroke, high blood pressure, diabetes, certain types of cancers, gallbladder disease, osteoarthritis, lymphedema, gout, and breathing problems such as sleep apnea. Basically, the reason for this is just going to be when you have that excess weight on your body, it's going to cause your organs to have to work harder. So your heart is going to have to work harder to pump blood to the rest of your body. Your lungs are going to have to work harder to provide oxygen to the rest of your body. And even your bones and joints are going to have to work harder as well. They're going to have a lot more stress. Physical therapy does play a role in the treatment of bariatrics. Working with a PT or a PTA can be extremely beneficial in the life of these bariatric patients. Physical therapy can help overweight individuals become more active and physically fit, which can lead to improved cardiovascular fitness, improved strength and movement. It can help with flexibility and posture, and it just increases their activity level because a lot of times these individuals are going to be sedentary. But there are some things that you would want to consider when you're working with an obese patient. They may fatigue more easily. They could have increased joint pain. I kind of spoke about that earlier, especially in those weight-bearing joints like in the lower back and in the legs. They could have increased difficulty with activities of daily living, and frustration and even depression is really common with these individuals because a lot of times, especially if they have an underlying condition, this could be something that they've been struggling with for a long time. They could have tried different exercise or different activities. They could have tried different diets and nothing's working, so they can become depressed. As far as bariatric equipment goes, for pretty much any type of medical equipment, there's going to be a bariatric option available, and that equipment is just going to be specially constructed to withstand larger amounts of weight. But it is always important to check those weight limits before you actually use them with a patient, because the last thing you want is some type of an accident because you didn't check that beforehand. They do still have weight limits. Some examples are going to include heavy-duty wheelchairs, extra care bariatric beds, and Hoyer lifts. And this, I hope you can see, is just going to be photos of some of those options that I just listed off. This bariatric bed here is going to help a patient come from supine to sitting, because most of the time they're not going to be able to do that themselves, and if you're in a room with them alone, there's absolutely no way that you will be able to help them by yourself. It would take several individuals. So this bed can help them lift up, and it actually has these handles here for additional help. And this is a bariatric wheelchair here. It functions the same way as any other wheelchair. It's just going to have an increased weight limit. And then this Hoyer lift here can be used to transfer patients from like a bed to a wheelchair, or whatever the case may be. There are two basic types of bariatric surgery. Restrictive surgeries are going to change the size of the stomach, which slows down digestion. And then the malabsorption restrictive surgeries are going to change the way that you digest food, but those can actually be more invasive. The four basic types of operations that are performed in the U.S. are adjustable gastric bypass surgery, the Roux-en-Y gastric bypass, biliopancreatic diversion with duodenal switch, or the vertical sleeve gastrectomy. This is just gonna, again, I hope you can see, show a photo kind of how those procedures work. The adjustable gastric band here is just gonna, there's actually gonna be a band with an inflatable balloon that's inserted around the upper part of the stomach here, and it's just going to basically change how much food the stomach can hold. It however does not reduce the amount of calories or the nutrition that is absorbed by the body. The Roux-en-Y gastric bypass here is going to create a small pouch here, somewhat like the pouch with the AGB, but what it does is just bypass a portion of the stomach. The vertical sleeve here, a part of the stomach is actually removed, which is going to leave this kind of like tunnel part of the stomach, which again restricts the amount of food that the body can withstand. And then the duodenal switch here. There are some general complications with these surgeries. Patients can experience nausea and vomiting, dehydration, food intolerance, overeating, or gallstones. A lot of times, like where it says overeating, the patient can actually only hold somewhere around maybe a couple of tablespoons of food, and anything over that, they run the risk of complications. When surgery is needed, physical therapy can help prepare those patients or help them recover from surgery. Preoperative programs often include strengthening, aerobic training, where postoperative programs are often going to start with breathing exercises and maybe some lower extremity range of motion as the patient is recovering, and that is going to progress to total body strengthening and aerobic training. That is actually all that I have, but if you have any questions, please comment and I'd be happy to attempt to answer them for you. Thank you for watching.